Welcome to the Beyond Pain podcast with your hosts, Joe Gambino and Joe LaVacca. Join the two Joes, two physical therapists, as they discuss how to navigate the uncertainties of pain so you can move beyond it and get back to the activities you love most. This podcast is for Joe, and their guests to share their clinical thoughts and ideas based on their collective clinical experiences. Can this information be for you? Maybe, but we cannot know for sure. Therefore, it is always worth talking to your healthcare provider to make the best decisions in your care before you implement.
Welcome back into the Beyond Pain podcast. I am one of your hosts, Joe Gambino, and I am here with I don't even have an adjective for you today, Joe.
Yeah.
I'll just call you Joe LaVacca today.
I was hoping you would say like impeccable or something like that. So
yeah,
maybe I'll throw in my own adjective
I will
today.
call you the impeccable Joe LaVacca. There you go. I like that you helped me out there. You can find us on Instagram. I'm at Joe Gambino DPT, and the impeccable LaVacca over there, he is at Strength and Motion _PT. You can find this podcast on Instagram as well, Beyond Pain Podcast. And this is also on YouTube, Cups of Joe _PT. And if you are interested in working with either one of us, there is an application form down in the show notes, so feel free to fill that out, and one of us will get back to you. And that's it, Joe. How you doing?
Well, as we were chatting offline, doing pretty well. The Yankees clinched their spot to the championship series, so I think we're both pretty happy about that.
That's right.
It was a nice series, hard fought. But I did like the way we pulled it together last night. The Judge even got a couple hits,
Finally.
walks, so maybe that's a good sign for us. Garrett Cole looked like he's like in his real aggressive self. I thought he was going to kill somebody when the bench is cleared. I just saw him walking over there, and I was like, no, don't do it. You're going to get suspended. Don't do it. And I was like, you know what? If he does it, it actually would be probably pretty cool.
Yeah. Well, we don't need anyone also getting hurt by throwing some punches either.
Fair.
So
that's fair.
Not
that's
at this
also
stage
fair.
of the game. But after we won game one, in that back and forth game, I was like, this is the game that you needed to win. That's going to set the tone for the series. So I
agree.
Somewhat confident after that. If we would have lost that game, I would have been very, very nervous.
Yes, I agree. Now, my question to you: have you been able to stay up for these games, even
I
with
stayed up yesterday,
a brand new baby? How are we doing this? How are you managing it? Give us your time management sleep sequence.
My time management sleep is a blessing because Jen's insurance plan offers night doula service. So
beautiful.
Well, we've been going to bed a little bit on the later side, especially with me watching some of the games. So I'm getting between 6 and 7 hours of uninterrupted sleep, 6 to 7 days of the week.
Wow. I feel like you said that with like a little bit of take that, everyone.
Yeah. Right? Yeah. It's like one of those, it's a flex.
It was a bit of a flex. I felt it in your voice, just a touch. Good for you, man. You should be flexing on that. That's awesome.
It's awesome because it's definitely something that we would not be able to do if Jen didn't have that as like a work benefit of hers through Carrot. So we actually had it for Olivia and didn't know, which we missed out on that back then. So
do you mean Lily?
No, Lily. Yeah, as you called my daughter like 17 times in the last episode.
Well,
but you can go back in and edit that out because that episode has not been released. So you could
That's fair.
You can fix it if you want.
I'll own up to it. So the context of that is Joe and his lovely wife have a dog named Lily. My good friend, who I spoke to the night before that podcast episode, has a daughter named Lily. So I just had Lily all in my mind that day. And I
we also call Olivia Livy, and we have a Lily, and it's very easy to, we do it all the time, so I let it slide.
All right.
But just once, Joe. Everyone gets one.
Just don't tell Olivia, and we'll be fine.
It's too late for that. All right, let's get into it, Joe. So today we have a question of the day, which I think we're just going to turn into a full-on episode because I think it's an important one. So the question is, when should I get an MRI? So let's dive into it here. Maybe instead of just starting when we should, or let's just leave it at that. Like, when should somebody, start considering an MRI as an option as opposed to just waiting it out or doing nothing or seeing a PT or something like that.
Right. And can we, is it safe to say that we can also say X-ray or MRI or
Yeah, any sort of imaging.
scan, right?
Yeah, anything that we're going to be doing, even if it's like those EMG tests or whatever, anything that we're looking at a deeper look inside the body for something that might be going on.
Well, first and foremost, if you have a trauma, I probably think it's worthwhile to get or lead into your process of recovery or rehab with some sort of a scan. And by trauma, I don't necessarily mean, you were lifting something heavy or you sneezed, slept wrong, right? All these different things. I'm talking you were on a bike and flipped off the handlebars. I'm talking falling down a flight of stairs. I'm talking, getting hit by a car, being involved in a motor vehicle accident. So something where a lot of force is delivered to your system or tissue in a very, very small period of time. And a lot of times I always kind of think of like this bubblegum analogy, right? Me and you could take bubblegum and very slowly pull it apart and it will kind of stretch and maybe leave that weird, like one piece of bubblegum that never seems to break, right? It's like a long hair. But if we delivered a very quick pull of the bubblegum, we can kind of get it to snap in half, right? So now that's not what I'm saying is happening to tissue, but just an idea of what the difference is with accumulation of force over time versus something delivered all at once. So I would say I'm going to stop right there and see what you think about the rule of trauma, get a scan, and does that always sort of jive with your thought process?
Yeah, to a degree, if there's significant trauma, fractures and stuff like that can definitely be associated with those things. If you had a fall on your arm, right? Like, I mean, there's different things that can happen that you'd want to, potentially get imaging. So, I think also how you're feeling and things like that can make all the difference, right? If there's bruising or swelling, right? Those are other indicators that, after some trauma that you might want to get something looked at. And then outside of that, I also think that, there's every injury, right? If you had a fall and there was you landed on your wrist and it was sore, right? You would imagine, or we know that there's a course, after a few weeks, right, it's just hard to get better, right? But if things continue to be irritated for a longer period of time than we would expect, then if you didn't get the X-ray or imaging up front, then you're going to probably want to start to consider it at that point. So also, what is the recovery looking like? Is something lingering around? Those will start to hint, maybe it definitely needs to be looked at if you decided not to opt into that at the beginning stages.
Yeah. And luckily for us, there are a couple of guidelines, right? I know that there are the Ottawa ankle guidelines, things like the Ottawa neck guidelines. And these are just things that guide me and you and maybe making a decision or, pushing people towards, some sort of imaging after a trauma. And a lot of that is just like bony tenderness, ability to move, what was the mechanism, to your point, I think is really, really important. I think the other thought that you had there was, well, if we do think it's more tissue based, then all of these tissues probably have a recovery time. So muscle heals better than tendon, bone heals a little bit better than maybe nerve does, right? So we have all these kind of classifications. And if we are assessing you or your clinicians assessing you and coming with an idea of what we think is happening, we should probably be able to give you a timeline. But then not only a part of the timeline, have some sort of objective tests to hold that up. We've talked on the podcast so much that pain is sort of bigger than medicine or bigger than anything we could probably find in a textbook because it's so individual to everyone's experience. However, if we think it is a muscle strain, right, as a simple example, and maybe there's a little bit of swelling, maybe there's some bruising, maybe there's a little bit of weakness, and we do an assessment, well then after, maybe a couple weeks to maybe max a couple months, I would expect that muscle to recover really well. I would expect the force output to be more normal or symmetrical to the other side. So even if someone comes back, 2 months later, 3 months later, and they're saying, hey, Joe, my hamstring is still hurting a little bit. Do you think it's time I should go get a scan? Well, me and you, or hopefully everyone else, should hopefully have the ability to fall back on something objective and say, great question. When we tested your hamstring or whatever muscle we were looking at when we first met, we saw a, maybe 20 or 30% difference side to side. Let's retest it. Oh, hey, look, with your 8 weeks of training, your 12 weeks of rehab, whatever, course you're doing, maybe it is even rest, who knows with some of these soft tissue things, but with that period of time, you're now 5% different from the other side. You're 10%. So the tissue we can see is responding because the behavior and the quality of that tissue is changing, even though you still have pain. So that's a great point. Don't think like pain necessarily is a reason to go get a scan, but can we tie that into something functional? Can we tie that into something objective? And then that maybe gives us a better balance.
Yeah, I agree with that. And, if we're staying on the topic of like x-rays, like when you have something significant to the joints like that, like all movement hurts.
Right.
And like if it's soft tissue or just like maybe joint irritation, you rub it, you give it some rest, you'd feel better. You do some passive movement, or probably like stretching it will probably be okay, right? But when you have a break, those things will all be irritated. And when I was, I don't know, maybe it was like 13, I was playing football, got tackled. Literally, I was like this far away from a touchdown, little shoestring tackle. I was trying to keep my balance, and I fell and I landed on the back of my hand, and I fractured my wrist. And I didn't think anything of it. I remember being in a lot of pain. I was in so much pain, I called my dad to come pick me up. I was literally 5 blocks from my house, right? So he came pick me up. I hung out for like 3 days. And remember after the next day, my wrist felt okay. If I moved it, it hurt, but I didn't have pain otherwise. And I remember I was just at like, my sister had a volleyball game, and as they were all warming up, I grabbed a volleyball, and they was in the gymnasium of our school. So there was basketball hoops. I did a layup. I was like, why does that hurt so much? And then I remember I went to my dad. I was like, man, my wrist still hurts. And then one of my friend's moms was there, and she looked at it. She's like, that shit's broken. It's like, you need to go get that looked at. So I got looked at, and lo and behold, I had a fracture and was casted and all that stuff. So, but again, right, it was like all passive, all active movement was painful. If I just rested it felt fine. And then if I did easy stuff, right, like I was like, man, why does that bother me so much? So I think like those are like distinctions. If it was just like a joint issue or I just strained something, it may have still hurt me, but I don't think it wouldn't have been to that extent. So, there's a little personal story of I didn't even realize it. I probably wanted to get it checked out. I was 13 years old. Who the hell, I was like, let me go to a doctor. Right? Someone has to tell me to do that at that point. So
I still think that's impressive, Joe, that you were able to last as long as you did. But the only thing in my mind that I keep hearing is that you didn't score the touchdown, which is really unfortunate. And if you're that close and you're going to break your wrist doing it, you got to get the 6 points, dude. You just got to figure out a way, whatever you need to do. But I still think that that's very impressive that you're able to manage a couple days, because now you're sleeping on that thing, which I imagine could not have been all that comfortable. But I mean, I guess you did it. Maybe you were just so full of like endorphins and just like, energy and vigor at 13. Because I remember in the playground of 6th grade, I was, running around, very similar mechanism, right? Kind of fell on the schoolyard. My wrist, kind of went in that same motion that you were describing. And I just remember being embarrassed, right? Like, oh my God, like I just fell in front of my friends. I was like, my wrist is really hurting though. I was like, but you know what? I'm going to just let these tears like swell up, turn really, really red, wipe these tears away from my face. And then I went inside. I remember like holding my arm like against my chest. And I remember taking a test, right? Because I think we had like some sort of math test or something that I had to take. And then I was like, all right, well, let me try to grab my book bag and see what happens, right? So my book bag was on the floor. I went to go grab it. And then I just remember being in the most pain I've ever been. Started crying, raised my hand. I was like, I got to go to the nurse. So my story is a lot less manly, I guess you could say. I did well on the test, but I wasn't like casually playing basketball with a broken wrist and like coming over the sideline and being like, hey, with my wrist dangling, like, I think my wrist might need a little bit of attention here. No, I was like, no, I need attention now. So I applaud you, brother. I applaud you.
Thank
But
you.
but I think the other one too, as I think about it now, I think would also be signs of systemic issues. And a few things come to mind. So persistent fever, maybe recent infection, maybe that also can go with recent hospitalization, right? Depending on the group you work with. Maybe prolonged corticosteroid use is something that we want to pay attention to here. Again, depending on the population that you're working with. Are we blowing off things that, maybe, a bigger, soft tissue injury or even bony injury because of medications, because of infections? So I would think of also just signs of general feelings of being unwell, right? Things that don't add up orthopedically or clinically. That would probably be another one where I'd say, hey, I think maybe we need to go back to your GP. Maybe we need to go back to even a rheumatologist, and then dive a little bit deeper. And maybe it's not a scan, but maybe it's blood work. Maybe it's a physical. And then you could probably tie in your client's history into that. I think that would be also a big, big clue on something that we might want to take a peek at as well from, a scan, blood test, sort of like deeper level than just some stuff on the table.
Yeah, I like that for when you have pain that's can't figure it out. Sometimes, you have like these things that don't make sense as far as
Right.
the clinical picture looks. So, but I do want to ask this question here because this is probably the thing that I hear most, right? Is, someone, maybe there's no trauma or anything like that, but someone has pain for a while and they have this urge to go to the doctor and to go get it looked at, and they need an MRI. And sometimes they need an MRI before they even feel obligated to go see a physical therapist and get it worked on, because they need the answer as far as what is going on. Like that's going to, make all the difference, especially, you and I both know we don't need that to make decisions to help someone rehab and things like that. So when you're looking at an MRI, how are you viewing it as like what it's good for? And at what point in the stage are you saying, okay, you should definitely 100% go get an MRI right now?
Yeah. Well, I guess the first part, what would an MRI be good for? For me, it's usually ruling out, right? I think at this moment in time, being 15 years out, maybe a little bit more, about 15 years out now, I'm pretty confident telling people, hey, you're going to have a tear. There's going to be a disc bulge. There's going to be bony changes. There's going to be loss of joint space. There's going to be this. There's going to be that. So if there is a lot of pushback for testing, and even if I share with people, hey, your prognosis or your outcome with therapy is going to be hurt by unnecessary testing, and I can pretty much tell you how I'm operating. I'm operating under the guide that you have this, 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 and this. So even if your MRI comes back and it only has 2 of those things, well, okay, I'm still going to approach this pretty much the same way. Now, if there is something outside of the realm of my considerations, then sure, the MRI might show us that. Maybe it would open up a pathway for different types of treatment. But I think then at that point, it's small sort of pushes towards different treatments. And we were, even chatting offline about different therapies like taping or red light, or, maybe we could throw PRP in there, or maybe we can throw something else in there. And I think, if you see something on the scan and we weren't considering it, and there is some sort of adjunctive medicine to help with that condition, okay, then wonderful. I don't mind if it's within your financial means, if it's safe to consider that. But what I would say then to your second question of like, well, when would I maybe try to push someone who is maybe reluctant to go get a test? And I would kind of go back to more nerve signs or maybe functional loss. And the things that pop up, and I don't know if we mentioned this in our sciatic episode, but it's worth revisiting. If you have profound muscle loss or function loss, if you have progressive function loss or, muscle loss or weakness, or if you have multi-level function loss or weakness, I think it's probably time to go get a scan. So, whether or not we're thinking of upper body or lower body, maybe, just because I brought up sciatica with our other episode, people have some pain down the leg. Oh, should I get an MRI? Should I not? I don't know. I've read different things about them. My friend said no. Someone else said yes. What do you think? And we see some loss of reflex, or we see a little bit of loss of strength at the foot. And we're like, yeah, this is pretty typical. We might expect this. Why don't we, give it another couple of visits and see what happens? And then all of a sudden they come in and, they start reporting that their knee is buckling a little bit more. They notice that the foot is maybe scraping across the floor. Right? That would be something that, hey, now is hacking multiple levels, is clearly trending either progressively or profoundly in the wrong direction. So, hey, you know what? Maybe it's time to go look at this tissue, make sure there's nothing taking off its blood supply, because we don't want it to become ischemic. We don't want or cells to start dying. So I think that would probably be the two things there. What's it good for? I think it's good for ruling out most of the time. And then when would I go? The 3 Ps: progressive, profound, or polymodal, or polylevel sort of thing.
Yeah, I agree with that. I think it's definitely for a rule out standpoint. So it's not going to be the first thing that I'm sending somebody for, but definitely motor loss. That's one. If there's any sort of radiculopathy, plus you've lost significant amount of strength, or you're noticing that there's muscle wasting, you're atrophying, the muscles are getting smaller. Like, just go get it. Bowel and bladder falls into that same concept there. And there's like a few other ones where, if someone's getting like a lot of locking of their knee, and then I'm suspecting a bucket handle tear, I'm probably going to go send them back to a doctor, because my clinical just from doing it, experience is telling me that, those are ones where conservative care doesn't always do the best, right? Because there's something actually impeding the joint space. And another one that just popped into my mind, that, the shoulder, if it's like weak and painful, and I'm not going to send them right away. But if I'm suspecting a rotator cuff tear, nothing's really kind of working, I want to just rule out that there's not like a really large rotator cuff tear that's really not going to do well. So there's a couple things that, I know if I see it, I don't know if PT is going to be the right way for them, so I'm going to send them. That's probably how I'm going to do it. Otherwise, it's if it's just things don't match up. So there's more pain than I would expect. There's night pain. There's, for whatever specific area of the body, all the symptoms that they're telling me, I'm sensing there's like a whole lot of things going on. Like, it doesn't make sense for one specific diagnosis. I'm probably going to go send them to get ruled out, because it doesn't make sense clinically. Like, if we're looking at low back pain or sciatica, right? Like, it's like very specific things that we look for. And if it's just like very general, they're telling me stuff that I wouldn't expect with things, I'm like, I don't really know here. Let's just rule everything out that's going to maybe impact, so we can just focus. Then we know, okay, hey, we're good. Now we can just work on PT and conservative care, and we should be able to find a solution that we're not going to miss anything that way. And then back to your point about, you were talking about, hey, things are just going to pop up on MRIs regardless. I look at MRIs, it's literally just a picture in the moment, right? So you're just going to get a snapshot of what your internal anatomy looks like. And there are plenty of research articles these days that show the older that you get, the likelihood of something popping up at any joint is going to be there, right? You're 80, you're 60 years old and you get an X-ray or an MRI, there's a really high chance that disc degeneration or arthritis or a labral tear or a meniscus tear is going to pop up. And it's not a 1-to-1 ratio, which is why I don't think anyone needs to rush out to get an MRI, unless pain's maybe been going on for a very long time and you want to rule something out, or things don't quite make sense, or you have some of these symptoms that, hey, maybe PT is really not going to be the best. We want to, rule out all this other stuff and make sure that there's not a better pathway for you to go, so we're not wasting time and wasting insurance dollars and all of that fun stuff.
Yeah, and I think it probably loops all the way back around to what we started the episode with. Even a bucket handle tear, I would probably assume, like, when we're going something like that specific with mechanical symptoms at the knee, you're probably not just waking up like that. You're probably not Beyonceing, that injury. There probably was some sort of like mechanism or trauma. Same thing with the rotator cuff tear. You probably have an athlete, you probably have a repetitive stress, you may have a fall, And even then, with even some of the rotator cuff stuff, I kind of operate, well, there probably was a tear there before. So, I mean, is there a bigger tear now? So I think age is always a factor when we're thinking about scans. When we sort of like hone in on specific things, like we mentioned the Ottawa ankle rules or the Ottawa neck rules, like there are certain things to even look for at the shoulder, from my understanding, external rotation loss, age, even lateral abduction strength of the shoulder. So that's moving your arm away from you. If all of those things are sort of like mixing, well, then yeah, you might have actually a better outcome with surgery if we do it sooner rather than later. But I think also ultimately too, like if we're going to go down the scan road and then accept different outcomes, I think it's also too about knowing what people want to get back to. And, I've had plenty of people just be like, hey, look, I don't know, even if the scan says whatever it says, I'm not getting surgery. I'm not doing this. I'm not doing that. And as long as it's not life-threatening, then I don't know if I'm the right person to be like, well, no, you should go back to playing pickleball and you should go back to playing tennis. I think if you want to, you can. There's no reason to be fearful. But right now, I understand your decision as a person going through what you went through. So if we want to avoid surgery, if we're really adamant it doesn't matter to us, it doesn't matter what the scan says, well then, hey, we just need to give ourselves time, compassion, patience, consistency, all those other things that we keep talking about. And then, see where we are in a few months and then make another decision, right? When maybe we have a little bit more, clarity and less emotions tied to it.
Yeah, no, I like that because, if it led down the rabbit hole of potential surgeries and stuff like that, I tell people surgery is always an option. It's not, whether you tried to do some PT first, if they're like, hey, I really don't want to do surgery. Well, all right, well, let's see what we can do over the next few months. And if nothing changes, then surgery is still the option for you, right? Like it's not going to disappear off the table. And then in a perfect world, right? Like, hey, you are feeling better and we can push that back or you don't need it. So, I like what you said there. And I do think that goals, even if it's like, hey, you have someone who like wants to get back to soccer or running or golf and they have a significant injury. Well, hey, if you really want to get there, maybe we need to go down this rabbit hole and you can educate and let obviously that person needs to make their own decision, right? We're just here to be a guide. But the last thing I want to mention with all this, just as like a summary, I mean, like if you're out there and you're wondering if you need an MRI, I would just either probably if you're seeing a PT or not seeing a PT or a rehab provider, I mean, go see one and just ask. I mean, we're able to give you an idea of what's going on with your body and do you need an MRI or anything like that? So if you're on the fence, I mean, that's going to be less of a time commitment, less, you don't have to worry about surgery, right? You just go for one assessment, kind of get a plan, figure out what's going on. And then if they're also telling you, hey, maybe you do need an MRI, well, now it's confirming your bias on what you think you need. And then you can go get one. And, it's just kind of educating yourself on your body in a sense of what's going on so that you can go out and make the best decisions for yourself. Because I see way too many times people just going in for the MRI, then the doctor saying you need the surgery, and then they get an unnecessary surgery. And if you kind of go through that process of evaluating it, going to talk to a rehab provider about what's kind of going on, and do they think that you need an MRI and what the plan should be, you can skip a whole lot of that stuff. And I think a lot of people are just driven like, oh, the medical field is here to help me. And they are, but at the same time, a surgeon might just say, hey, well, this is what I do and this is the way I can help you, right? Versus, and it may not just be the best thing for you at that time. So I think that's my last 2 cents. And you can follow up with that, Joe, if you want, or you can take us home, whatever you like.
No, I think it gives a good segue to a future episode. When do I need surgery or when should I consider surgery? So it's like a cliffhanger. Ooh, I like that. I love it.
That was unintentional.
All right, let's do it. So you want me to take us out or you take us
home?
All right. Well, thank you for joining us for another episode of the Beyond Pain podcast, everyone. Joe, I love you. Listeners, we love you. And if you've made it this far, extra love to you. Don't forget to like, subscribe, share this episode with someone who you think it might help. And we'll see you next week.